everyone, this is Dr. Asad. I'm a naturopathic doctor here at Gentle Wellness Center, and I pick a health topic, give some health tips for my patients about every week. And today I was asked, what are the top 5 things that I treat, or patients that come to me with the top 5 health problems? So I would say that my top 5, let's look at thyroid problems. Almost every other patient that I see has some sort of thyroid issue, whether it's sluggish, whether you're actually diagnosed with a thyroid problem like hypothyroidism, or you have autoimmune thyroid issues like Hashimoto's. So almost every patient I'd say I've seen has had a thyroid problem, whether they knew that they had a thyroid issue or they didn't know and their thyroid was sluggish. So that has to be my top one. I always look for also thyroid problems if you don't know you have it and you're coming in with symptoms that are pointing towards a thyroid problem. Just expanding on that, when I say you don't know when your thyroid is sluggish, when we in alternative medicine, or say functional medicine or naturopathic medicine, when we look at labs, or when you come in with your thyroid labs, we're not just looking for the ranges that the lab gives. If you are borderline up or low on a lab, where we like to approach that and we like to get you better, get your labs better. We're not waiting for your labs to get out of range and then approach that to get you better. If you have symptoms, your labs are borderline, that's the time when we want to take an action. So that's the first, my top one. I would say second, it could be my top weight loss. Patients that are coming in for patients that are obese or overweight, they would have all other health problems. So they would have metabolic syndrome, like we call hypertension, and they would have high cholesterol. You know, they would have these health problems that are just kind of come with being overweight. And so I'm not going to look at those as on their own conditions that we have to look at. You lose the weight, you eat healthy, you know what your lifestyle should be, those things start to get better. So overall health and wellness include weight loss and include all of those. So that's my top one. My third, and they're not in order of priority, I'm just picking my top 5, but my third is women's health. I've seen a lot of patients with PCOS. I'd say my success rate has been pretty high with that. And we're not claiming that we cure it, but PCOS management has been pretty high with herbal medicine, with nutrients, lifestyle guidance. I've had many girls whose symptoms got better and had a better quality of life. So we're absolutely not claiming with anything that we're curing it, but we're making your quality of life much better and managing the symptoms and making you feel better. So that's my third. My fourth, mental health. I have seen, it's unfortunate, I have seen many kids in their teens, in their 20s, and say young women, males with mental health problems, so depression, anxiety, and their parents do not want them to be on those medications starting so soon. So when those patients come in, I've helped them with lifestyle guidance, nutrition, and different things that we do as naturopathic doctors. And mental health is always it's always challenging for parents, for kids, but that's what that's been also my top priority with all patients. So number 5, I know that some of these are very broad, but chronic health conditions that include autoimmune conditions like Hashimoto's, so rheumatoid arthritis. I would say I've seen a lot of patients for rheumatoid arthritis, and when patients go into flare, it's tough to get out. It's difficult. The movement is difficult. That stiffness that they feel, and remember, it's a health journey. The more you follow the recommendations, the longer you follow, you feel better. So, going back to chronic health conditions, RA, lupus, autoimmune conditions overall, we approach them the same way. Cancer, if you have cancer, we are here to support you. So we provide nutritional guidance, what supplements you should be taking if you are going through chemo, if you are going through chemo and radiation, or if you have had that and your body needs to bounce back, nutrient deficiencies that you can have with chemo, how your immune system should be supported during or after chemo. So that's something that we can provide, and I do work with cancer patients as well. Having said that, we do have oncologists in the office, so this is all working with them. We're not asking you to stop your treatments or start any other treatments. We're focusing primarily on supporting your body with naturopathic medicine. So those are my top 5. If you have any questions, please feel free to reach out. We offer a 10-minute free consult to see if our approaches fit you better, and we'll be happy to help.